and she's definitely real.
Yeah, definitely. Big up to Kevin Seckerson, co-worker, Westchester County Jail. Big up to Kevin Seckerson. Big up to all the correction officers, first responders. But the ones that we don't talk about is your correction officers. New York City, which they don't talk about, is over 1,000 officers are out sick um, at in New York City corrections, and the press is not talking about that. We have a good number of officers out sick, and if people did not see the Low HUD article. There's 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 officers and inmates affected by this, and I think it is a fluid situation where um, management of these departments, whether it's police, correction, EMS, essential services, or first responders, they have to keep up with the science and keep up because it's changing. It's constantly changing. When 2 months ago, it was, they were saying, well, you got just stay 6 feet and you be okay, right? Now we find out that just being 6 feet from a person, you could still catch it. They're finding out now that just not the droplets will go down to the ground, but there's still a mist. And now they're finding out also that people that are asymptomatic, that are not showing any symptoms, are carrying the virus. Before they was telling us, well, you can't get tested unless you show symptoms. But now the data is showing that a great number of people that won't show symptoms and are carriers. So I think it's fluid that uh, responders, essential workers, our elected officials should be able to get all of us tested immediately, so you know what you're dealing with, instead of waiting for someone to get ill. So by the time that person is sick and showing symptoms, he's probably had the virus for at least he or she has been at work, had the virus for 2 to 3 weeks, and then infected other people. I mean, being in corrections, um, and any correction officer will tell you that we go and we're exposed to a lot of things. In the 90s, it was AIDS. It was the AIDS epidemic, and we had to restrain and sometimes be spit upon. And if we were getting physical and there was any blood, we had to worry about the AIDS epidemic. And then you had the SARS epidemic, right? Swine flu, MRSA, hepatitis. These are the things that correction officers face because of the lack of circulation and the closed in, and these germs fester. So washing your hands and keeping clean is something that an officer is trained to do, and is told to do from day one. And we used to, in the AIDS epidemic, we used to, um, um, JT Fitzgerald, another co-worker. God bless you, brother. Uh, and you got some COs, retired COs coming on the line, and they would tell you, we were told, in the 90s, treat everyone as if they have AIDS. That's how you. That's the best precaution, is to treat everyone as this if they have AIDS, and this is the same precaution. Um, yeah, yeah, yeah. Yeah, we just have to be precautioned. We need those same precautions. Treat everyone as if they have the virus. Um,
Absolutely.
Danielle Kenyon says, and people are passing around this disease intentionally in public areas. Just got to be safe. People are the problem. Well, yeah. Yeah, yeah. You know, the biggest problem in this is people not caring. Go ahead, AJ.
Now, I wanted to ask you a question. Working in corrections, I know I see a lot of the medical, healthcare workers complaining that um, they're not given the tools to protect themselves. I wanted to know, is that the case in corrections, not just yours, but corrections, period?
Well, I mean, it's a struggle. It was a struggle to get face masks. You know, not just, I'm talking correction. Period.
Mm-hmm.
Um, it was a struggle to get face masks. It's a continued struggle to it's a continued struggle to make sure that we have enough equipment and making sure. But a lot of it is the officer's responsibility because the officer comes in with it. So he has to make sure he's following precautions when he's not at work, not just when he's working,
Right, right.
but he's not at work. But it's also um the management and responsibility to know what they're dealing with. Same way Dr. Fauci says, we won't know what we're dealing with until we do enough tests, until we increase, our tests. It's been my opinion all along, and I respect, my commissioner, it's been my opinion all along that the whole the the, the whole department, should be tested. You know,
Yo,
you know.
as far as those numbers, I've been saying as far as the numbers, yo, since people are not being tested, whatever the numbers they're giving you, you can almost multiply them by 10. Because, especially in a densely populated area like Mount Vernon, like you got buildings and everybody's in the building, and you know what I mean? And it's like,
Mhm.
I went to the store to get something and I seen people congregating outside the store. Like, you know what I'm saying? Like, people are just not, the people are not, there's a lot of people staying inside, but there's a lot of people outside that just don't need to be outside, just hanging out. No mask, no gloves, just hanging out, sitting around, smoking weed, passing it around to the next one. I'm like, yo, you got to be kidding me.
Lorraine asked a question. Good morning, Damon. Have you seen my brother around? We haven't able to see. Hold on. Tasha's having problems. Tell him to log out and log back in. Let me try to. Let me see if I can bring